Good evening, everyone. My name is Glecy and I work at RCRMC Labor and Delivery floor. Working as a nurse can be challenging because I am not only working with my patients, but as well as other healthcare providers and ancillary staff. Tonight, I will be discussing the definition of healthcare communication, its relevancy of effective healthcare communication to health outcomes, and as well as how the lack of effective communication between personal and professional healthcare communication contributes to poor health outcomes. In this video, I will show you modes of communication that can enhance effective communication between interdisciplinary staff and the theories and principles of therapeutic communication in healthcare. Healthcare communication or quality clinical communication is defined as communication of the completeness of diagnostic information, compliance with treatment, and client satisfaction with care. Clinical communication skill is an essential in achieving positive outcomes and client satisfaction. In this first scenario, it depicts an effective communication style between the doctor and the nurse.
Hello, this is Dr. Lequette speaking.
Hi, Dr. Lequette. This is May from 3500 Medical Wing. The reason I'm calling is that Miss Taylor has become suddenly short of breath. Her oxygen saturation has dropped to 88% on room air. Her respiratory rate is 24 per minute. Her heart rate is 110 and her blood pressure is 85/50. We have placed her on 6 liters of oxygen and her saturation is 93%. Her work of breathing is increased. She is anxious, her breath sounds are clear throughout, and her respiratory rate remains greater than 20. She has a full code status.
Okay, get a chest x-ray. I'll be there to assess the patient as soon as I can. If any immediate changes occur, please call me back as soon as possible.
Okay, thank you.
In this scenario, May, the registered nurse, properly identified herself and identified that the patient she is taking care of. This scenario depicts the reporting of the situation to the physician on the status of the patient that is under their care. The nurse also identified intervention that has been performed and its effect on the patient. The physician sensed the urgency of the situation and communicated to the nurse what orders he wants and verbalized that he will be there immediately to see the patient. This is a sample of a complementary circular model communication that depicts the S-bar, which is the situation, background, assessment, recommendation style of reporting. In addition, the physician offered an open line of communication for the nurse to call him back for any sudden change of status. According to Arnold, practicing use of standardized communication formats by nurses has been found to improve their ability to effectively communicate with physicians about emergent changes in the client's condition. Scenario 2. May is a new labor and delivery nurse in the unit, clarifying orders to the doctor.
Hi, this is May from Labor and Delivery Department. How can I help you?
Hi, May. This is Dr. Lequette. Do you have Mrs. Jones in room 6?
Yes, we do, doctor.
Her blood pressure is pretty high and there's protein in her urine. I need you to bolus magnesium sulfate immediately.
Doctor, I just want to clarify your order regarding the magnesium sulfate bolus.
I just need you to bolus magnesium sulfate 4 grams immediately, okay? She really needs it.
Okay, doctor.
May grabbed this magnesium sulfate and bolused the patient with a rate of 999 mL per hour. The patient ended up having respiratory distress and had to be given calcium gluconate as an antidote. This scenario portrays how communication breakdown between interdisciplinary team may cause harm for the safety of the patient. Debriefing between interdisciplinary healthcare team members should always be done after an incident has happened so that problems can be solved and to have a better outcome for the patient. Being sensitive about the diversity of culture, ethnicity, socioeconomic age, and literacy is an important factor in being able to communicate to the interdisciplinary teams. Furthermore, sensitivity to the receiver of the message in regards to how to communicate is an important aspect for the receiver to understand the message sent. Communication skills of the healthcare providers are important for the work ethics, which forms the foundation of practice that is important for ensuring patient safety and quality care. Effective communication is accomplished when the different providers can effectively translate what the physician says by the way of action. The circular model of communication takes into account the role relationship between the communication, either symmetric or complementary roles. Symmetric roles are equal, whereas complementary roles relationship typically operates with one person holding a higher position than the other in the communication process, which right now in our scenario is the physician as the higher position compared to the nurse. Nurses assume a complementary role of clinical expert when helping the client to achieve mutually determined health goals, and a symmetric role in working with the client as a partner on developing mutually defined goals and means to achieve them. This is as well as working with other interdisciplinary team. It is a symmetrical role, and I believe that in this video, you learn the different modes of communication and realize that effective communication can increase positive health outcomes and as well as positive environment for both the physician and the nurses.